It's still Ask Dr. Ken, your number one channel for reproductive health related issues and solutions. My name is Esther Mark, and it's a privilege to have you join us on this episode. Today, we'll be talking about how painful the process of IVF is.
Oh yeah, it's an interesting one. I was already laughing before you finished the question. Oh well, you see, you just meet some couples or some female folk, and you've already determined you're going to have IVF, and IVF process is going to start immediately.
Okay?
And then the first question that a good number of them asks,
Is
I
it
heard this procedure
painful?
is very painful. Is
Some
it
of us
really
have very
so?
low threshold
You
for
know,
pain.
yeah, so it's actually a very pertinent question, how painful IVF procedure is. You know, I would say that the IVF procedure is not particularly painful. Yeah, but then if you look at the period of taking the injections, yeah, you know, you have a lot of centers, especially in this part of Africa, sub-Saharan Africa, that still use the daily shot of injections that are given under the skin subcutaneously, and they can have these injections for close to 2 to 3 weeks, you know,
Consistently.
consistently
Oh,
on a
wow.
daily
That's
basis,
very-
and that may just be tiring and not necessarily painful, because it's similar to the kind of insulin injections that folks that are diabetic, you know, uses. So they have these daily shots. The IVF injections are not necessarily as deep as the paracetamol that other folks take, or some kind of intramuscular injection that some people take. But what I think is the continuous nature of having to take a jab can be very tiring and can be frustrating, especially when you're doing the long standard protocol or you have to take injections for a long time. So whether
In consideration to
painful,
other
oh yeah,
mental issues running around.
exactly. So if you put
head.
all those psychological issues, mental issues, emotional issues, then having to take jab for 2 weeks running or 2 weeks
6
plus,
weeks.
that can actually be a little bit frustrating. So I'd rather describe it as being annoyingly frustrating than painful. That's the medication section, okay?
Okay.
So then you get to the period when you have to do the oocyte retrieval
That's the egg.
with the egg retrieval. You know, this is a theater procedure, and then you have this needle.
I keep wondering what it looks like.
Oh yeah, it's a needle like 15-inch long, 15 inches long,
Oh, heaven.
you know, and it's very thin, very tiny. And for me, I will just imagine that it's like the same needle you use for injection, even though it's long. It's long so it could reach the ovary through the vagina. So you only have one prick.
Oh, it goes through the vagina.
Oh yeah, through the vaginal
wow.
wall to the ovary. So for me, it's just one prick on the vaginal wall. Then you have a prick on the ovarian wall, and several other prick intrafollicular.
Okay.
So you could get out the eggs. So but then a woman is usually under sedation.
I was going to ask if there was anything like anesthesia
Yes,
and all that.
she's usually sedated before these procedures
knows
are done.
nothing about
she
what's
doesn't
happening.
know, she doesn't feel the
Oh.
pain of these procedures.
But there should be an after effect.
Oh well, yeah, that's where I'm heading for.
Okay.
You know, during the procedure, it's expected that she's under anesthesia, she's sedated, and so she doesn't feel pain. You know, but then the anesthesia is not forever.
Wears
It
off.
wanes or wears off few minutes after the procedure.
Okay.
But then she could have some pains. You know, she could have some pains. But then it's expected also that she should be on some analgesic
Okay.
after the procedure, so the pains are kind of tolerable. So they are necessary pain, if you call those pain, you know, but then during the main procedure of egg retrieval, oocyte retrieval, she's under anesthesia, so she doesn't feel pain. So there is no cause for worries. It shouldn't make them lose their sleep before the day of the procedure, because they
think
don't
that's
even know
important.
when
What's
the
going to
procedures
happen.
are done, how the
Okay.
procedures are going. You know, but then you could feel some pain afterwards. But then you also
How
will
long
be
does this pain last?
Hey,
The
well,
after effect.
the after effect, to be frank with you, I am not very sure. But I could imagine that this pain or discomfort, I'll call this discomfort now.
No longer pain?
No longer pain.
Okay.
Discomfort, yeah, could last a period of 2 to 3 days.
Uh-huh.
You know,
I was
but
thinking
then,
you were going to say weeks.
No. 2 to 3 days. Yeah, 2 to 3 days. But then they'll be under some form of analgesia. You know, paracetamol.
Still under that 2 to 3 days?
Oh yeah. But you know, the whole of the procedure for egg retrieval just lasts like 3 to 5 minutes.
Really?
Yeah, 3 to 5 minutes.
I was thinking she would be in this theater for like 1 to 3 hours.
Just 3 to 5
Oh,
minutes.
wow.
Yeah, she just has the
Okay,
procedure
well,
just
I
runs
think
for
I
like
can-
3
I
to
can
5 minutes because it's a minor
Quick
procedure.
process.
So it's not even qualified to be called a surgical
Surgery.
procedure. Yeah, but then it shouldn't be called a surgery, but maybe a surgical procedure.
Okay.
Done under ultrasound guide,
Okay.
you know, and the pains are not very big pain, the minimal pain. And for some folk who are used to bearing pains, they can actually go through this procedure without
And they
having
wouldn't feel
anesthesia
anything.
and with some little sedation, and that would just be fine. You know, so I think there's undue attention or undue emphasis placed on the pain than the
Why do you
procedure
think
itself.
it's so? If there is undue emphasis placed on the pain, don't you think people who have actually gone through that process experienced it, and in that course they transferred all the aggression to the pain and lock?
Oh yeah, you see,
If it's not so painful, I don't want to believe they would shift focus from the process itself to the pain.
no, I'm not trying to belittle the pain
Yes, you said
that they may have complained about. But what I'm saying is that it doesn't seem to be that painful because these procedures are done under anesthesia, so they don't even know you're pricking them. You understand? They are calm, they are quiet, under control anesthesia, and they don't feel pain. So they only feel this pain when you're done with the procedure and the anesthesia has waned, and they just feel some discomfort. So I call that discomfort. But even with that, they are still placed on some form of analgesia for some 2 to 3 days to block the pain, to stop the
Which
pain.
also leads me to the next process or the step involved, transferring the embryo back to the woman or the mother in quotes now. Is it not also painful?
No, that is not painful at all.
At all?
There's just
you
no
don't
pain.
Use a needle to prick
There
her.
is no cut involved. There is no pricking involved.
So how do you do that?
Yeah, the cervix has an orifice. We call it the external cervical os and the internal cervical os. They are just like the orifice opened externally, and the embryos are loaded into what we call a tiny catheters. And those catheters are plastic, and some of these plastics are actually very flexible. And they can actually go straight into the uterine
like
cavity.
You're shooting a rocket.
Oh yeah, go straight to the uterine cavity without the uterus even sensing occasionally that you have dropped something in it. So there's actually no pain at all. There could be some discomfort, and the discomfort could be when you're trying to expose the cervix using the speculum. Some of the speculums are plastic, rubber, some of them are metallic. And you can imagine you're passing this metallic or rubber substance through the vagina. It could cause some discomfort, but that amount of discomfort, I don't think is qualified to be called pain. So that's actually the most painless, if at all there is any pain, the painless process of IVF is the embryo transfer. She feels no pain at all. You don't even give analgesia. You don't give anesthesia. It's not sedated. Her eyes are wide open. She's wide awake during the embryo transfer. Yeah, and if she knows how to interpret ultrasound finding, she will see the embryo transfer happening live.
For real?
Yeah, without knowing, without feeling any pain.
Okay.
Yeah. So that's how it's actually.
It's very painless.
It's painless.
Minimal.
It's painless. Yeah, minimal.
Something
pain.
everyone could.
Yeah, but then the good thing is that the pains are blocked.
So thank you for being with us on this episode. We'll see you next episode of Ask Doctor.